Good afternoon, ladies and gentlemen. My name is Elliot Wilbur. I'm with NKDHC, the Access Center. And the issue we are currently facing in our workplace is a nurse shortage. There are many things you can do during a nurse shortage, but I feel like I have the ultimate solution. Okay, so first thing I'm going to show is the large piece of the pie is a nurse's hours during the 90s. And then the little box, it shows that the patient's stay was longer than about 7 to 8 days. And in the orange box, it is currently about 4 to 5 days. But the nurses stay in average now of 10 hours. And in the 90s, the nurses stayed about an average of 7 hours. And that's just because there was more nurses then, so the patient time is a little bit, not as long with one patient. So the nurse also didn't have as many patients then as they do currently. And the next thing you have here, it's a little harder to see, but this is just some things nurse average and means that they have on a chart in Florida. This is where the information was gathered. It was on a study done in Florida. And this is a way that they fill gaps. They float nurses from one section to another, and just move nurses around. But for us, it doesn't really matter because we don't really have nurses from another ward. We are a small clinic, and in our clinic, it's one nurse to one patient. However, there are days where we have multiple patients, and our days get slowed down because we have a nurse shortage. There's things that we do, like other places. We have per diem nurses that come in and assist us when they can. But with us, the issue we have with our per diem nurses, their hours vary. So when we're short-staffed and we can't get nurses to come in and cover, it is harder for us to work, and our workload is increased. But our employee numbers have gone down. So as our workload increases, our productivity also increases. But the days end up longer, and we end up having overtime, and some of the staff is starting to get a little burned out from that. As I continue to the next slide, this just shows us how many exams we do. We do about 12 on average, and we only average about 3 to 4 nurses and about 2 to 3 techs. We're techs are fine. We rotate and we do this and that, so it's okay because we're only in the procedures. The nurses, however, they have to pre and post-op our patients. So as you guys know, it is a little harder to get done when there's things that need to get done, and all right, well, we're all ready, but there's not enough nurses here to bring patients back to get them pre-op and to go into the room. So when that happens, it slows us down quite a bit. So my ultimate solution is honestly to hire 2 additional nurses to our nursing staff. With this being done, 2 nurses, the best way to do this, it'll increase productivity, and we should be able to get our day faster, and it will also be able to make us see more patients throughout the day. Now we average about 9 to 12 patients a day, depending on what we're doing in the clinic that day. And I believe with 2 additional nurses, we should be able to do 11 and 14 cases on a regular basis. With increased patient numbers, increases productivity and revenue for the clinic. So if we stay above our numbers, our revenue will increase. And with the reimbursement rates changing in Nevada, it is common to see how we can, some certain medical equipment might cost more, certain procedure might cost more, and all that varies currently. And the way I see how to do this, the best way, if we hire 2 new nurses, we should focus on nurses that are fresh out of nursing school. The reason I say this is because nurses out of nursing school, they want to have experience and working experience. Getting hired on in a hospital isn't as easy. It's more of who you know, not exactly what you know. With us, it's our type of clinic is much better than working in home health care. In home health, it's kind of the same thing. You see the patients, draw labs, just check them up, make sure they're okay, help with, if needed, changing sheets and dressings and all that type of things, which is what nurses need to be proficient in. But it's also not as well rounded if you want to further your career. With us, all of our patients are either on dialysis or going to be on dialysis. And as you doctors know, all of our patients are ticking time bombs. Their health is not in the greatest shape. So there's things that happen in our workplace that are, over our heads, during procedures, and even, after the procedure's over, or even before the procedure starts. In some cases, that, the patients, their blood pressure will tank, or they'll get fluid, and we have to, call the ambulance. They need to go to the hospital. But during that time, if we have more nurses there, it'll be safer for the patient. If they end up coding, we have to do CPR. More nurses there will be able to help. Because this rad techs can only do so much. But if there's more nurses there, it's safer for the patient. It's less work that the doctors are going to have to do. And that, continue. That ends my slide. And here's some references from where I got the information in the charts. Thank you guys. Have a good day.